Ankylosing spondylitis, what you need to know. Ankylosing spondylitis, is a type of arthritis that affects the spine and sometimes other parts of the body. Arthritis means inflammation of the joints, which are the places where two bones meet. Inflammation means swelling, redness, heat and pain. What causes AS? AS is caused by a problem with the immune system, which is the part of the body that fights germs and diseases. Normally, the immune system protects us from infections and injuries. But sometimes, it can attack our own tissues by mistake. This is called an autoimmune disease. In AS, the immune system attacks the joints of the spine, especially where the spine joins the pelvis, the lower part of your back. This causes inflammation and damage to the joints. Over time, this can make the bones of the spine grow together and fuse. This means they become stiff and hard to move. This can affect your posture and make you hunch over. What are the symptoms of AS? The main symptom of AS is back pain that lasts for more than 3 months and does not get better with rest or common painkillers. The pain usually starts in the lower back and buttocks and can spread to other parts of the spine. It can be worse at night, in the morning or after sitting for a long time. Other symptoms of AS may include 1. Stiffness in the spine that makes it hard to bend or twist. 2. Swelling and pain in other joints, such as the hips, shoulders, knees or ankles. 3. Inflammation of the eyes, causing redness, pain and sensitivity to light. 4. Inflammation of the bowel, causing diarrhea, stomach pain and weight loss. 5. Fatigue, feeling very tired, and fever. How is AS diagnosed? There is no single test that can diagnose AS. Your doctor will ask you about your symptoms, your medical history and your family history. They will also examine your spine and other joints for signs of inflammation and stiffness. Your doctor may order some tests to help confirm the diagnosis or rule out other conditions that can cause similar symptoms. These tests may include 1. Blood tests to check for signs of inflammation or genes that are linked to AS. 2. X-rays to look for changes in the bones of the spine or other joints. 3. MRI scans to show more detailed images of the spine or other joints. How is AS treated? There is no cure for AS, but there are treatments that can help reduce the pain and inflammation, slow down the damage to the joints and improve your quality of life. These treatments may include 1. Medicines to reduce inflammation and pain, such as non-steroidal anti-inflammatory drugs, NSAIDs, corticosteroids or biologics. 2. Physiotherapy to help you exercise and stretch your spine and other joints. 3. Occupational therapy to help you with daily activities and make changes to your home or work environment. 4. Surgery to correct severe deformities or replace damaged joints. How can I cope with AS? Living with AS can be challenging, but there are things you can do to manage your condition and stay healthy. These include 1. Following your treatment plan and taking your medicines as prescribed. 2. Doing regular exercises that are suitable for your condition, such as swimming, yoga or Pilates. 3. Maintaining a good posture and avoiding slouching or bending over. 4. Using heat or cold packs to ease pain and stiffness. 5. Eating a balanced diet and drinking plenty of water. 6. Quitting smoking if you smoke. 7. Getting enough sleep and rest. 8. Seeking support from your family, friends or a support group. HLA-B27 test, what it is and why it matters. HLA-B27 is a type of protein that is found on the surface of some of your white blood cells. White blood cells are part of your immune system, which helps you fight off germs and diseases. HLA-B27 is also a gene, which means it is a piece of your DNA that tells your body how to make this protein. Why do you need to test for HLA-B27? Some people have a gene mutation that makes them have more HLA-B27 protein than normal. This can cause problems with their immune system, making it attack their own healthy tissues by mistake. This is called an autoimmune disease. There are some autoimmune diseases that are linked to having too much HLA-B27 protein. These include 1. Ankylosing spondylitis, which causes inflammation and stiffness in your spine and other joints. 2. Reactive arthritis, which causes inflammation and pain in your joints, eyes, and urinary tract after an infection. 3. Juvenile rheumatoid arthritis, JRA, which causes inflammation and pain in your joints in children. 4. Anterior uveitis, which causes inflammation and redness in your eyes. If you have symptoms of these diseases, such as back pain, joint pain, eye problems, or skin rashes, Your doctor may order an HLA-B27 test to see if you have the gene mutation. This can help them diagnose your condition and plan your treatment. How is the test done? The HLA-B27 test is a simple blood test. A nurse or a technician will take a small sample of blood from your arm using a needle and a tube. The blood sample will be sent to a laboratory, where they will check for the presence of HLA-B27 protein on your white blood cells. The test usually takes a few days to get the results. Your doctor will explain what the results mean and what you need to do next. What do the results mean? The results of the HLA-B27 test can be positive or negative. 1. A positive result means that you have the gene mutation that makes you have more HLA-B27 protein than normal. 1. This does not mean that you have an autoimmune disease, but it means that you have a higher risk of developing one. 2. A negative result means that you do not have the gene mutation that makes you have more HLA-B27 protein than normal. 2. This does not mean that you do not have an autoimmune disease, but it means that you have a lower risk of developing one. The HLA-B27 test is not a definitive test that can confirm or rule out an autoimmune disease. It is only one piece of information that your doctor will use along with your symptoms, medical history, physical exam, and other tests to make a diagnosis. What are the risks of the test? The HLA-B27 test is a safe and simple procedure that has minimal risks. Some possible risks include: 1. Pain or bruising at the site where the blood was drawn. 2. Bleeding or infection at the site where the blood was drawn. 3. Fainting or feeling dizzy during or after the blood draw. These risks are rare and usually mild. If you have any concerns or questions about the test or its risks, talk to your doctor before taking the test. How can I prepare for the test? There is no special preparation needed for the HLA-B27 test. You can eat and drink normally before the test. You can also take your regular medications unless your doctor tells you otherwise. You may want to wear a short-sleeved shirt or a shirt with sleeves that can be easily rolled up to make it easier for the nurse or technician to draw your blood. You may also want to bring someone with you to drive you home after the test if you feel faint or dizzy.